Some women still struggling to have their partners with them for scan appointments and throughout labour. Is this acceptable?
No, it's not acceptable. And in fact, one of the real concerns we've had throughout the pandemic has been the impact of COVID on patients who don't have COVID. And that is because we have a situation where the NHS infrastructure is woefully lacking in terms of the facilities and doctors and staff we have, which means that not only are we trying to cope with the surge of cases of COVID, we have the second problem of the backlog of care that has developed, about millions of patients who have not been seen during the first peak. And now we have the unfortunate prospect of a challenging winter. This is probably going to be the most difficult period that doctors will be experiencing in their lifetimes approaching winter.
The most difficult period, so worse than the first wave?
Well, the first wave came during spring, moving to summer. What we have now is an accumulated numbers of patients, millions on waiting lists. There are over 100,000 patients waiting more than 12 months for treatment. That's more than 100-fold than the summer of last year. And we have, on top of that backlog, the surge in numbers. About some of the hospitals in the country have about 20% of their beds occupied by COVID patients. Some are seeing more COVID patients than they saw during the first peak. We have over 700 patients today on ventilators. In the beginning of September, it was about 70. So you can see this trajectory is quite alarming. And when you add that together, and then you have every winter, of course, increased pressures with more respiratory illnesses, these three pressures converging together is placing the NHS in a very, under pressure we've not seen before coming up to winter.
You're talking about the impact on patients who don't have COVID-19 as well. You've done a survey for members, haven't you, about their concerns about cancelled appointments or other people not being able to access the NHS in the way that they should be able to. What does it show?
So our survey shows, and it's just been published today, so it's very up to date from about 7,000 doctors. What it shows is they are extremely worried about their ability to care in the coming months. You know, doctors do not want to see patients unable to access care, and that refers to cancer patients, heart disease patients, patients with rheumatological conditions. They don't want to be in a position where there are millions on waiting lists and not knowing when they will receive their care. And that's one of the real worries. We mustn't forget, you know, the several million who are now waiting for hip operations, cataracts, etc. They have no idea when they will be seen. And what doctors are also worried about is staffing. At the moment, 4 in 10 doctors tell us that their clinical colleagues are absent from work because of self-isolation or because they are infected themselves. That is adding pressure to a system when we started before the pandemic with 10,000 doctor vacancies. So there's a very real issue about staffing. There's also an issue about facilities and beds. At the moment, NHS England figures say that we will be entering this winter with fewer beds than we had last year. There's only about 1 in 3 doctors tell us that where they work, it has sufficient ability to separate COVID and non-COVID patients. And let's remember that in order for infection prevention control, you can't have hospitals and GP surgeries operating the same way. You have to have fewer patients, less density, because of the need to create that separation so that we don't see spread in hospitals, which also we know has happened in the past. So there are real challenges ahead, and it's really important that the government is clear about those challenges and is clear with the public about what reality is. What we feel is absolutely important is that anyone with an urgent medical problem should not be deterred from contacting the service, and the service must continue to provide that parallel service for non-COVID patients alongside COVID patients. We don't want to go back to the first peak when we saw in March only 50% of patients with heart attacks attending hospital. We must make sure that the needs of patients who are urgently ill are met this time round, whether they have COVID or not.
Yeah, certainly some really concerning issues coming this winter. Your survey also shows that doctors seem quite sceptical about the current restrictions in particularly Tier 3 areas and whether they will work. What kind of concerns are being raised?
I think our biggest concern is that what the government has not spelled out is a proper preventative strategy. There's no point having a lockdown in tier 3 and then going back to the tier 1 measures if it was successful, which clearly led to this. What we need is a sustained approach, and we believe that there are infection control measures, there are ways in which to create COVID secure environments, and we haven't heard any of that. All we've heard is about acting after the horses bolted, locking down an area, and then the worry we have is that after that we go back to square one. So what we believe is there is a need for much greater clarity, and also the move from tier 1 to tier 2 to tier 3 is highly confusing. We need very clear trigger points, but most importantly, what happens after?
Yeah, big questions there. Just very quickly, lots of people will be looking ahead to Christmas, wondering whether they can have anything like a normal Christmas. Do you think the government should temporarily relax the rules, or does that risk a rise in infections?
I think the most important thing is what the government does today now. If we can, and if the government can have a coherent approach to ensure that there is proper infection control measures in society when people go out to work, when people go outside, at the end of the day, there is actually a very simple message here. This virus cannot spread if people don't mix. And it is possible. We've shown during the first peak that it is possible to bring the infection down. In July, then that is after the lockdown was eased, we were seeing only 500 new cases a day. We are today seeing well over 20,000 on a daily basis, 23,000 yesterday. So we need to get back down to what we achieved before. And that is all about behavioral change. We've done it before. That should be the priority so that we can allow the public, the population, to start to have some sense of normality in terms of being able to have Christmas, seeing their loved ones. But I have to be clear that the normality that I'm describing won't be normal as usual. It could be a new norm where we have to work and mix within infection control parameters. But what the government does today will determine what happens at Christmas, and what the public behaviour is today will determine the infection in the weeks and months to come. Because, as I said, we've seen this dramatic change in just 2 months.